Good morning. This is Tanja Pink, or maybe evening, depending on where you are. Tanja Pink, 2005, and I've been contemplating about this and really not really knowing how to start, because how do you start with telling your story as a breast cancer survivor? And this is a little emotional for me because I was first diagnosed in April of 2005, and then again in May of 2010, and today is January the 20th, 2015. So coming up on that 5-year, 10-year period, and I am due to get tested here in the next couple months or so. I stand on faith that there's nothing there, but the human nature part of me just keeps rearing its ugly head. Just really wanted to give an opportunity to hear. When I was first diagnosed, it was a very interesting story because I was having pain in my right and my left breast. So just went to the doctor, wasn't feeling real well, and I had a baseline about 13 months prior to the mammogram in 2005. Doctor said, no, it's probably nothing. She said, but you know what? I'm going to go ahead and get you checked out because you're 42, even though you don't have a history of breast cancer in your family, but let's just go ahead and get a mammogram. So I went and got the mammogram, and the lady said, look like, did you have used deodorant? Maybe we need to come back and get it redone. So that's what I did. I came back in and got it redone. Went on family vacation. The doctor called me like as soon as I got back and said, well, I need for you to come back in for just your results. I said, well, I'm active duty Air Force and I am on my way on travel. She said, well, as soon as you get back, let's talk about your results, or let's talk about the mammogram. Really didn't think anything about it. So the doctor made me an appointment about 7 o'clock in the morning, which my husband thought it was unusual, but I was like, you know what, I'm active duty military. Doctors sometimes have to fit you in when they can. So I went in and she says, I have some bad news for you. I was like, what kind of bad news? She said, well, you have cancer, you have breast cancer. And not only do you have it in one breast, but you have it in both. And you have DCIS, which is ductal carcinoma in situ. But it seems to be more prevalent in your right breast versus your left breast. So she showed me the film and she said, yours is a little different because you have striation, like milky lines going throughout both of your breasts, and there's no way we could just do a lumpectomy to take out a piece. She said if we did that, we would be taking the whole breast. She said, but let's go get what is it called? A biopsy. So she said, we're going to do a biopsy of the right breast. So I said, okay. So made an appointment for like the next week, and while I was there getting the biopsy, the doctor who was doing the procedure, he said, well, why didn't they order one for your left breast as well? I don't know. He said, well, we're going to go ahead and do both breasts, especially since it's shown in both breasts. The technician was a little hesitant. She said, we don't have any orders to do that, doctor. He said, listen, the lady is here. We're going to go ahead and do both breasts. So results came back, and it actually showed that the left breast had a small area that was outside of the ductal walls. So it was HER2neu negative, but that small little piece was less than 2 centimeters. So that's usually, they use a gauge, so it's a very, very small area. So what he decided to do was to send me to Walter Reed. They had a very good breast cancer center there. So went there. So went to what is called triage. And what happens there is that you get all the you make an appointment, and all the doctors decide on, they reading your files, what the next process is going to be. So my husband and I went. We saw chemo, we saw radiation and nutrition, several different doctors. So what they decided for me, since it was more invasive on the left side, they decided to go ahead and do a total mastectomy with tissue sparing and immediate reconstruction, where they put the devices under your skin, and you have to go in every 3 to 4 weeks to get them pumped up with saline to create the breast. So there at Walter Reed also saw a plastic surgeon, but one of the things that the doctors, they had debated, or not really debate, but had decided, and of course me not knowing, that since it was just a small area that's outside the invasive wall, that there was no need for chemo and no need for radiation. So went for the surgery, talked to the doctors. They felt that was the best thing going. But the funny thing is, you know, when you tell, how do you tell your husband, how do you tell your children that you have breast cancer? My husband was very devastated from it, but we've been married now going on 22 years, and he's been with me through both procedures, and I have to say he's been a gem. And the first time, in 2005, I was 42 at the time. So I told the doctor, I said, all right, doctor, how you tell a woman who's 42 years old, still trying to get a groove on and partying, that she has to have both of her breasts removed? So that's one of the reasons why they sent me to Walter Reed, was to have the immediate reconstruction. So I had a great plastic surgeon, Dr. Bonacari, who is active duty at the time at Walter Reed, and actually he's still my plastic surgeon today. And so went for that. Things seemed to be chugging along, even after the reconstruction, even after the actual implants were put in. I had saline implants put in, again there at Walter Reed, another surgical procedure. So things were just chugging along, and in March of 2010, I found a lump on my left side. So you ask, how do you find a lump on your left side when you don't have any breast tissue and you just have an implant? I thought that to be strange. Actually, when I went to the breast center there at Walter Reed, they just really shucked me off, and I really was put off and very offended by that, because I could feel it. It was right under the skin, because right under the skin is just an implant, and with tissue sparing, they stretch your skin, so your skin isn't as taut and as thick as it was when it was your actual breast. So I knew Dr. Bonacari was there, so I actually went around to his office and said, "Hey, sir, found a lump here on my left breast, and it doesn't feel right." And the first thing he said was, "You shouldn't have anything there, because they took all your tissue to include your nipples, so there shouldn't be anything there. Even if it is, we need to get it looked at." So what he did, he set me up for a mammogram, he set me up for a MRI, and he set me up for a one other procedure, I can't think of the name, an ultrasound. All those things came out inconclusive. The MRI showed that there was something there, but they really couldn't tell what it was. So he said, "Well, why don't you go for a biopsy? You can have a biopsy done there in the breast clinic, or we can take you down for surgery." And he said, since it's right under the skin, it may just be beneficial to go for the one in the office. So mind you, I had implants under the skin. So the doctor went in and did just a local. So she just punctured just briefly into where the breast was and where the the lump was. So it came back negative, and they seemed to be all okay with it. But I said, you know what? I'm sorry. There shouldn't be anything there, and I want it removed. They's like, well, Miss Thompson, it doesn't show that there's cancer there. I said, you know what? For just my personal satisfaction, I think it needs to be removed because I shouldn't have anything there. And actually, the left breast was the worst of the two breasts. So I said, you know, so they honored and said, okay, Miss Thompson, we're going to go in and take the lump out, and we are going to do a biopsy. So I was actually on travel when the doctor called me because I was I active duty at the time? No, I wasn't active duty because I retired in 2007. So I was actually working at the time, and I was on travel. And they called me and said, Miss Thompson, we need for you to come in. I said, for what? They said, your test results. I said, no, you need to tell me now. I said, I've been through this once before, and I know what the signs are. And she said, well, Miss Thompson, you do have breast cancer again in that left breast. She says, not only do you have one DCIS, but it's estrogen positive too. And we need for you to come in. I don't know what my attitude or what my feelings was, but I just was like, oh no, not again. So I told my husband, told my kids, still not knowing what was going to happen next. So went and seen oncology, went and seen radiology, and the doctors concluded that since I had breast cancer once already, one type, and now I have a second type where the estrogen positive was at a higher rate than what they would have liked, and the lump was well over 3 centimeters that they felt they needed to go in and take it, because when they went in before, well, yeah, they took it, and they said, well, Miss Thompson, look like you're going to have to go through chemo and radiation. So just to back up a little bit, the doctor that took out the lump, I don't know what she did, but the area did not heal. So and I came back into the office, and they said, no, this is normally just complications that you might have when you have a lump removed. And I said, but it doesn't seem like it's healing. So about a week later, I came back into the office, and it was a big hole. You could actually see the implant under it, and I just kept trying to put something over it, and it was just growing larger and larger. So immediately when I went to see my the breast surgeon, the plastic surgeon, he's like, my regular doctor wasn't there, so it was another doctor that was there, and he's like, Miss Thompson, I'm sorry, but you need to have this removed. You need to have this implant removed. So what do you mean implant removed? He said, yes, and we need to do it now because you could potentially have that's an open area that can potentially infect your whole system. I said, well, I can't do it today. I need to come back. So what they did, they scheduled me for the next day to have the implant removed. So can you imagine what my feelings and what my thoughts was? Even when I think about it now, I get a little emotional. It's just really, really difficult, especially now like I mentioned, that I had it in 2005, 2010, and it's now 2015. But it's January, and like I said, I'm standing on faith. So they went in and they took the implant, and they set me up to go see a specialist to have a prosthetic, just something to put in my bra so that I wouldn't be flat-chested on one side and have breasts on the other side. So went through chemo, went through radiation, and that was if you ever never been through chemo, if you've never been through radiation, it does a lot to your body, and of course the chemo took out my hair the second or the third week after I started, and actually started chemo October the 1st, and by 3 weeks later, by Halloween, I was completely bald. I started radiation probably that February or that March time frame, and it totally burnt my skin. And then 6 months, no, well, I would say about a year after I completed chemo and completed radiation, I decided, the doctor said, well, you know what, it's time, if you're thinking about having reconstruction. And I said, well, what are some of the possibilities? They said, well, since you have tissue sparing, the breasts, we can't do anything with that breast as far as trying to reconstruct it on its own, because the skin has already been stretched enough, and we had to take some of the skin from when you had the implant removed. So what I decided to do was have a transflap. And what that is when they take in this case, they took the left side of my stomach muscle, and they cut like an oval shape from the bikini line all the way up around the navel. And they cut it, and what the interesting thing is, they leave it there. They kind of detach it, and you walk. It's kind of hard to explain, but they cut that skin out to see if it will live, basically, to make the flap for the breast. So that August, I believe it was that August, it was that August, I had the transflap. It's called a transflap delay. I had that done, and within 3 weeks later, actually had the transflap surgery. Well, with the transflap surgery, they take part of your muscle, they take that tissue, and this will be part 1 of a series of video clips as well as pictures